So let's talk about this. I have seen several places kind of where it's talked about, where it's kind of mentioned that no, plastic surgeons actually shouldn't be doing cosmetic surgery because our training is mainly reconstructive and cosmetic surgeons are more well trained. That's just misinformation, like through on all aspects, just a lot of misinformation. Yes, I am board certified plastic surgeon. I'm trained in plastic surgery. Plastic surgery is a broad term, right? So when you train in plastic surgery, you learn reconstruction, you learn cosmetics, you learn critical care, because as a plastic surgeon, you actually do general surgery training as well. So part of my training was actually learning trauma and being in the trauma ICU and learning how to take care of really sick patients. Why is that important? Because and at the time when you're doing this training, you're like, why am I doing this? I want to learn surgery. But it's all part of the training, because when you're out on your own and you're finished training and you're taking care of patients, you have to know and identify, is this person sick or are they not sick, right? Because here's the thing, the majority of the time surgery goes well, people heal well, but occasionally, like, things may happen. Someone calls you and they have a complaint, and how do you know if that's like serious or not? How do you know if they need to be seen in the emergency room or something? How do you make that distinction? It has to do with the background training that you have in all the years that you train, right? Because training is not just about learning surgery. Like, that's a part of it, but a big part of it is how you take care of patients. And do you understand how to repair hernias? If there's a hernia, you find a hernia during a tummy tuck, or do you understand, it's so much involved, which is why, like, when a dentist is doing cosmetic surgery, you should be alarmed and you should be concerned, because at what point are you learning about where things sit, the layers of the abdominal wall? At what point are you seeing that for your own eyes because you did bowel resections or you did trauma in your training, right? It's so much more involved than just learning how to do surgery. Like, that's part of the training, but it's comprehensive. Now, here's the thing. We learn reconstructive surgery, we learn cosmetic surgery. Learning and knowing how to do reconstruction is important, because I find that when you're doing surgery, you have to come at it from both aspects or viewpoints. You have to think about it, okay, reconstructively what I'm doing, right? Like, even, let's take, for example, a tummy tuck. You're reconstructing the abdominal wall. So you have to have that reconstructive mindset as well as the cosmetic mindset, and put those together well to lead to a nice result. Same thing if you're thinking about, let's say, a breast asymmetry or someone with, for example, Poland syndrome, maybe an underdeveloped breast. Okay, we have to come at that with a reconstructive and a cosmetic mindset. After my plastic surgery training, I actually did an additional year focusing exclusively on aesthetics or cosmetic surgery. Now, many of the training programs in cosmetic surgery that dentists do or gynecologists do, or pediatricians, like, seriously, like, all these some people don't even do a residency and just start doing cosmetic surgery, maybe. And how long is that training? Let's think about that. So that training might be 2 months, 6 months, 1 year. You're comparing 7 years of training, right? So I did 6 years, which was plastic surgery integrated, which means I did some general surgery, then did plastic surgery, to 1 year. So it's not really just about learning surgery. That's a small part of training. You got to learn how to take care of patients. Let me learn the anatomy, both seeing it, feeling it, taking care of patients on the floor, and the other thing too is that, like I said, reconstructive and cosmetic go so well together. Now, so we're comparing 7 years of training to 1 at the most. 7 years in plastic surgery exclusively, 1 year at the most in just cosmetic surgery, but not really even thinking about the trauma training and all that. So it is apples and oranges. It might be apples and broccoli. Like, that's what we're comparing. And so just be careful when you see that, because it's all, unfortunately, like, it's the Wild Wild West. It is very much driven by what can I do that's going to give me the most financial gain. And so when you are doing your homework, like, look closely and make sure you see, don't just look for board certification. You got to look for board certification in plastic surgery. All right, y'all. Catch y'all later. That's all I got today.